Hi everyone. In today's video, we will learn about one of the deadliest viruses which has been responsible for the current outbreak in Democratic Republic of Congo, that is the 17th outbreak in the DRC and killed around 139 people. It belongs to the family of Filoviridae and morphology, so it is not having a proper particular shape. It is being pleomorphic in nature. Mostly appears as a elongated filamentous thread which ranges from 80 to 1000 nanometer in length. And the infection from Ebola virus is highly fatal. The mortality rate of this infection is around 50%. And this virus mainly causes viral hemorrhagic fever. So Ebola virus has become a global threat because of its recent outbreak in 2014. So this was declared by World Health Organization and considered this as a public health emergency of international concern. So there are different subspecies of Ebola virus, which includes Zaire, Bundibugyo, Sudan, Thai forest, Reston, Bombali, etc. And these different subspecies differ from each other in their nucleotide sequences. The subspecies which is causing the recent outbreak is known as Bundibugyo. Coming to pathogenesis and clinical manifestations, so reservoir of this Ebola virus is fruit bat or primates like apes and monkeys. So why the people of Democratic Republic of the Congo or Sudan are at high risk of developing the infection, or why there will be more outbreaks in these regions? So it is mainly because of their lifestyle. So these fruit bats are there in high number in these areas, and the people in those regions come in close contact with these animals, and also those people eat these creatures. So that may be the reason of high rate of transmission of infection. So how this Ebola virus transmission occurs? So through the close contact with the blood, body fluids, organs or secretions of the infected animals like monkeys, chimpanzees, fruit bats into the animals or into the humans, from the animals to the humans. And if one person gets infected, it can easily transmit to the another individual through direct contact, maybe through the cuts on the skin or through the mucous membrane. Virus enters into the another person's body, and also through the blood, secretions, organs or body fluids of the infected person, it can spread to another person. Also the inanimate objects which are infected like beddings, clothing, syringes also carries this virus. And the healthcare workers and close contact of the infected person, they will be at higher risk of developing the infection. So personal protective equipments are must. Then incubation period. The incubation period ranges from 2 to 12 days. So virus enters into the person's body through the cuts on the skin or through the mucous membrane, and it reaches the lymph nodes, regional lymph nodes, and it spreads to the various internal organs of the body and results in the infection. Initially there will be flu-like illness which may include fever, headache, muscle pain, sore throat, etc., which is followed by abdominal pain, vomiting, diarrhea, rashes with hemorrhages. So there will be mainly damage of the blood vessels which leads to hemorrhage and often leads to multiple organ failure, shock and death of the infected person. So lab diagnosis, how the infection can be diagnosed. So we can collect the serum sample of the infected person. We can detect the antibodies, both IgM and IgG antibody can be detected separately by ELISA commonly or immunofluorescence test. Then antigen also can be detected by capture ELISA. Then molecular method to detect the viral nucleic acid, that is RNA, by RT-PCR. Then also directly from the sample, the morphology of this virus can be observed by electron microscopy. Then we can cultivate the virus using viro cell line. So the laboratory personnel, while handling the sample of these infected people, should be extremely careful. They should be wearing all the personal protective equipments, and the sample have to be handled inside the biosafety level 4 cabinet, so that the transmission of this virus infection can be prevented. So prevention methods. Mainly the people who are infected with the Ebola virus should be completely isolated from other people, and while giving care or treatment to the patient, strictly infection control measures have to be followed, like wearing personal protective equipments, following proper hand hygiene, and also all the equipments or instruments which are used for the infected person have to be completely properly sterilized. And avoiding direct or indirect contact with the blood or body fluids of the suspected cases of Ebola. And attending funeral of the Ebola infected person have to be avoided, or all the personal protective equipments have to be worn while attending the funeral. If any person is traveling to Ebola outbreak areas, he should be properly monitored for 21 days after returning for any symptoms. Then coming to treatment part, supportive care can be given, like symptomatic treatment to it can improve the survival rate, and there is no treatment or vaccine which is proven is available. Thank you.